My name is Mary Patten, and in June of 2021 I was diagnosed with breast cancer. I went for a routine appointment to see my GP, who had been my GP for many years. I had been experiencing an itchy nipple. Within the appointment, she had a look and examined me. She later then told me that she knew immediately that it wasn't looking great. I had an ultrasound, a mammogram, and it was there that I was told on the 1st of June that I had breast cancer. I was very comforted by Dr. Veronica because I'm from the UK and Dr. Veronica had spent many years working for the NHS in England. I knew that her experience and expertise was going to be some of the best. She also listened to me, and I felt that she really provided me with a lot of comfort in what was an absolute bombshell of information when I was initially diagnosed. In my case, the doctors decided the best course of action was to have chemotherapy first and then surgery. Halfway through my chemo, it was decided, given the results of biopsies, a mastectomy was essential in order for me to fully get rid of the cancer. Dr. Veronica and I sat down and discussed this at length, the different options that I could have for the mastectomy. It was then decided that once I finished chemo, that I would have a double mastectomy. I had the surgery at Mediclinic City Hospital. Dr. Veronica, of course, came to see me after the surgery. She came to see me the next day, basically just made herself available to me whenever I needed to speak to her, whenever I needed to ask a question or advice. Should this be happening? Should I be feeling like this? Should I be feeling like that? And she was always available. And honestly, it's been a real pleasure to have her as my doctor. But if I could give one piece of advice, is to choose a person and doctors and a medical facility that you can really trust. And I would never hesitate to recommend Mediclinic. In a situation that is very challenging, Dr. Veronica has really been there for me, and I would never hesitate to recommend her to others who are about to start this journey. Thank you, Dr. Veronica, for just being your incredible self, your experience, your kindness. I could not have got through this journey as well as I have without you, so thank you from the bottom of my heart.
I'm Dr. Veronica Grassi and I'm an oncoplastic breast surgeon working at Mediclinic. Because of the type of her cancer, she needed neoadjuvant chemotherapy, which means chemotherapy before the surgery. I have performed a bilateral skin-reducing mastectomy and targeted axillary node dissection with sentinel node, along with immediate breast shape reconstruction with direct-to-implant reconstruction in the prepectoral plane. Post-operative recovery was uneventful. Mary went home day one post-op with her drains, and she's been instructed by our team and the breast care nurse how to deal with the drains and how to empty. Because her lymph node persisted positive after the neoadjuvant chemotherapy, Mary had to have radiotherapy. She then developed capsular contracture on the affected side. A year and a half after completion of radiotherapy, I proceeded with implant exchange on the affected side in view of capsular contracture and fat transfer to her breasts. This procedure is very common and I use it a lot, and it's called composite reconstruction because it's partly reconstruction with an external material, foreign material, which is the implant, and autologous material, which is the fat. Mary is doing very well. She's back to her normal life, and I'm very pleased with her cosmetic outcome. My message to everyone will be, if you're undergoing a mastectomy and reconstruction, you should be aware of your options. You should find a good breast surgeon you rely on, and don't be afraid to ask questions. So if you notice any changes or if you have any concerns, please come and get yourself checked.